various emergencies of all sorts we have been treating just with homeopathy. We have lots of children who come to us with various sort of acute complaints. It may be injuries, it may be burns, it may be anything. Mind you, burns, as I was telling you in the OPD other day, burns has excellent scope in homeopathy. Okay, if you treat burns, you really understand the magic of homeopathy. I remember a little kid was brought to me. This was a kid who was usually only on homeopathy. When the mother was coming out from the kitchen with the pail of milk, she put it, instead of putting it on the table, she was just on her way putting it on the dining table from the kitchen. And instead of putting it there, as she turned, she didn't realize that her child came rushing from there, and the whole milk tilted onto this child right here, down there to her dress. There was absolute chaos, and as usual, like I said, for all emergencies, they contact us. She contacted me. Unfortunately, just the preceding day, my father had expired, so I was not attending the clinic. And because I was not attending the clinic, she did not go to the assistant, but she chose to go to the GP nearby. The GP dressed the wound, did everything possible, and the wound seemed to get worse. There came a time when if she entered, you could actually smell her, okay, dirty pus pouring out. So she gave me a ring and told me that I'm sorry, but you will have to see my child. So on the third or fourth day, I said, I'm not attending clinic, but if you want, you bring the child home. So this child was brought home. The moment this child came home, she sat and she asked me, and she said, in Gujarati, she asked me, "Tame su karso?" Okay, so I said, I have to see what is happening. So she said, no. Okay, I could see the terror in the child's eyes. She said, no. I said, no, I have to see it. And because I had to see it, and normally this is a child who would always obey to anything and everything that I would have told. There were two people holding her, okay, and I was pulling away the dressing from there, when ideally speaking the burn should not have been dressed at all in the first place. Okay, and along with the burn came out the skin completely. Okay, I remember seeing skin on one side and gauze piece on the other side. Okay, and as I put it, I could see that not only her skin, but even the nipple had come out along with it. All the skin over the nipple had come out along with it. It was a terrible state to see. Then we tried and cleaned the wound only with sterile water and nothing else. And I told the mother, do not use any local application at all now, nothing. Okay, and I see the child every 24 hours. The child was in agony. Okay, the child would run here, would run there. Finally the child ran away into my kitchen. Okay, and she went into the kitchen into one corner, and there we were pulling the child out of the kitchen to be able to see what the problem is and clean her up and so on. After a little while, when she settled, she would sit on one sofa. From there she would get up and she would go to the other sofa. From there she would go to the other sofa, and she would say, burning, burning, burning. You know, in Gujarati she would say, bade, bade, bade. Okay, and the father are busy fanning her with the newspaper that was there on the table, because that was the only first available thing they could catch hold of. Remedy we gave this child, friends, is arsenic alb. Okay, and with arsenic alb she cleared up marvelously. We used no other medication, not even sulfadiazine, nothing. 30 I think, because that would be the only potency, either 30 or 200 would be at home, I remember. Okay, and I remember giving it from my house and not from the clinic. No, repetitions must have gone in, maybe in water every 2 hours. Okay, we give a plusing potency in water every 2 hours. So it must have gone on quite repeatedly at that time. What I was immensely worried about was the fact that if this child, even when the child's skin gets back, what if the breast does not develop normally? What if a contracture appears, and exactly there if the contracture, what will be the shape of the breast when this child grows? Okay, so they said, shall we go and take a opinion from the pediatric surgeon, from the cosmetologist? I said, by all means go to and let us see what they have to say. Sure enough, the concerned plastic surgeon said that I think SOS you need to do surgery, okay, because you need to correct. Okay, now this is a child who's only been on homeopathy, so they told me, supposing we don't do it now, what will happen? So I said, maybe we might need it a little later. So can we wait for some time? I said, let us speak. So we spoke to the concerned plastic surgeon and asked him that can we wait? What will happen in case, so he says, if the deformity happens, then it will be a little more difficult operation than it is now. So we decided to take a chance. I am very happy to tell you, friends, today now the girl is almost a teenager, all is fine. Forget the contracture, there is hardly any mark left there now. Okay, so I can tell you that burns can be very well treated with homeopathy, and burns victims usually these days are a lot of children with lot of accidents which happen at home.